Hello, my name is Lukas Haske and I'm from Morita, the category manager for our laser solutions, and I'm here with Dr. Chok from Slovenia, and we will talk about our erbium YAG laser. And yeah, so thank you for having you here in Amsterdam at the Europerio 9. And so we are here today to discuss our erbium YAG laser, and my first question, what was the first contact with lasers, or have you any experience with also other laser devices, or maybe not an erbium YAG laser?
In our office, we didn't use any lasers since we started with Morita. I tried at the same time another laser, but I was much more satisfied with the Morita one because the handpiece, yes, is more comfortable and more similar with the handpieces that we use normally in our work. That's why I decided to take the Morita laser.
And for how long are you using it?
Yes, I am using it for 2 years now. We use it almost in all the fields that are present in dentistry, from endodontics as additional rising help at the end of the endo treatment. Then in perio, we use it after the root scanning and root planning for disinfection the pockets. And the patient says we made a split mouth test. On one side we used the laser, on the other side we didn't use it, and the patient says that after the procedure is much more comfortable on the side that where we used the laser. They had less pain, and also the healing was a little bit faster.
So even the patients see some benefits due to the usage with our laser. So when you treat with our laser, okay.
We try it because you believe the facts that you hear, but let's say if you try it and then you see that it really works, then you are more satisfied with that.
So when I understand it correctly, you use it for endo cases, you use it also for perio and also periimplantitis?
Yeah, we treat also periimplantitis. Perimucositis at the beginning, when the inflammation starts, sometimes is before we were rinsing only with peroxide. Now we use the laser, and in some cases you have the completely healing after 3-4 sessions with the laser. Sometimes it's not so useful, but also when with the cases that are more difficult, I see that where I have to open the flap, if I use before the laser, the inflammation is not so huge as it was before I started to use the laser in the pre-treatment.
And how was the beginning when you started to use our laser? Was it difficult to get used to the technique, or was it simple?
No, it's quite simple. The program is easy. You have also all the memories inside, so you just look what you have to do and you push 2 buttons and you can start working.
And is it now a replacement for other mechanically treatment solutions, or do you still use both, for example, periimplantitis?
For periimplantitis now I use always the laser, and then I do the other procedure, the augmentation and so on, but always with the help of the laser.
And what are the biggest advantages of our laser for you?
If we go to the soft tissue, when you cut with the laser, you don't need to put stitches after the procedure because it coagulates at the same time as you cut. Okay. And this is much easier for the patient. He doesn't have the stitches and you don't have to remove it after 1 week. So for the small muco-gingival procedure is a good thing.
Is there something you can do only with our laser, what you can't do, what you couldn't do before you were using our laser?
Let me think about it. For example, the frenectomy, I do it only with the laser, and I don't need the scalpel, I don't need the stitches at the end. When we remove mucochela, I don't need other things. I just cut it out with the laser and coagulate with the laser. Okay, endo, you cannot use only the laser. It is an additional help, but it works better than before without laser.
Okay. And how is it in Slovenia? Do you get any extra money when you use our laser by the insurance companies, or because in Switzerland, for example, they get per 5 minutes usage with our laser 35 Swiss francs. In Germany, okay, the patients has to pay out of their own pockets. And how is it in Slovenia?
So in Slovenia, the insurance company covers the standard procedure, and laser is not a standard procedure. So when you treat the patient using the laser, you can charge some additional fee for the procedure. And they are glad to pay because they hear about the good things that brings the laser. So it's not a problem to get some additional paying for that.
And in many cases you don't need anesthesia, so rather spend maybe €50 extra instead of getting an injection. So I would pay for it.
Yeah, sure. For many soft tissue procedures, you don't need the anesthesia, and the patient is always glad when he doesn't need to get the injection.
I can understand, totally understand. And if we take a look into the future, next generation of laser, now the Atwell Evo is our third generation of lasers. And what would you think about what we can place in the laser, or what is missing in the laser, or how could it be even better than now?
I don't know, but erbium, I think that everything what you can do with erbium laser is already in the Morita laser. So I don't know what to say, what I don't have in the laser that I should need. But I think that with erbium and Morita is a winning solution.
Okay, thank you very much. It was nice talk to you, Dr. Chock. Thank you again. Thank you for watching, and yeah, see you next time.